presentation. Thank you so much for taking the time out of your day to come today. And I know the sun's just come out and it's a beautiful day and there are other priorities and it's never the right time. It's never the right time, there's always something going on, either floods or vivid in Sydney, and so many people are there. But thank you very much for being here today. And we'll be talking about this. You know why we're here. But I also just wanted to, before we formally start, ask Priya to come and do an acknowledgement to the traditional custodians of the land.
Hare Krishna, everybody. Again, thank you for coming. We'd just like to start today's presentation by acknowledging the traditional custodians of the land on which we are meeting today. I'd like to extend our respects to the Aboriginal people of the Biocycle Nation who have lived and derived their needs from the beautiful forests, rivers, streams of this beautiful valley in which we are for thousands and thousands of years. So I'd like to extend my respects to the elders, past, present, all peoples here today and all future generations. So thank you.
Thank you for that. Thanks for that, Priya. And thank you very much for the beautiful gift that everyone to get us started. So we will be talking about, so we have a mental health team, but it's not just mental health. Mental health is a tiny component of it. Not tiny, a big component, but what we are mainly doing is the aim of this team, and I'll actually introduce each of us and go through our sort of roles and our structure and how it's all going to work. But basically, pastoral care. So I think a lot of us would be familiar with that. Pastoral care is an ancient model, and basically what it is, it sort of takes into account, it's basically meeting the needs of a community or an individual as it arises. And it's like, needs like, I'm about to get married, what am I supposed to be doing, sort of thing. So it's almost like a community mentoring sort of thing. So it's working, it's meeting emotional needs, social needs, spiritual needs, and academic needs as well. It's in all spheres of one's life that basically, a group of us have sort of put our hands up and said, okay, we are happy to be there as people, as resource personnel, basically. We are happy to kind of try to fulfill this role and help people meet their needs in a way that is overall for their holistic spiritual benefit, but also to maintain health. So it's partnerships, because we can't do it alone, obviously. It's like somebody coming and saying, I need to do this. So it's not a talking down model. It's not I'm the authority, just listen to me, not like that. It's a partnership, and that's what it is in any nurturing, caring relationship. So so pastoral care is the holistic approach, and social well-being, emotional well-being, and mental well-being is all closely linked. So there's a lot of us actually in this community, many of us, and many who are coming to light, who are qualified by their material qualifications to be doing mental health work. And so we all sort of thought that, there's such a need. So the pastoral care is basically, there's a need, let's meet the need. What can we do to meet the need? And it's people, everyday people, like you and me. It's not, any sort of big person or big personality that comes along, but basically a community is formed by the relationships in it, and relationships are a big part, which I'll talk about a bit later. So, yeah, we just thought it would be a good idea to use our skills that we have in devotional service as is natural. When we have like a musical talent or a dancing talent or an artistic talent, we want to use it in service. So we thought we could use our professional skills to help devotees. And one of our big sort of my personal big motivations was, Lord Chaitanya's philosophy of Namaruchi, Jiva Doya, and Vaishnava Seva. And so out of those three, stays for the holy name, having compassion on living entities, and doing service to the devotees. So out of those three, very, very interestingly, service to devotees is the key. And by serving the devotees, we get the mercy of Lord Chaitanya, which then gives us a good taste for the holy name. And then, now that we have that mercy, we can now do Jiva Doya and distribute out the compassion to everybody. So Vaishnava Seva takes many forms, and there's obviously the physical side, which Ambika Prabhi is looking after for many years now, that side of devotee care. And then there is we all thought that for the mental health side of things, because it's such a niche and sort of special skills are needed, it would be wise to have a group that is specifically trained for that area. Now I just want to say that in the Western world, as we know well, that there is impersonalism and voidism. And we know that, it's right there in Prabhupada's pranam mantra, which is Namaste Saraswati Deve Gauravani Prachadani Nirvikshesha Shunyavadi Paschatya Desha Tarini, which is these Western countries are full of impersonalism and voidism. And every time we bow down to Prabhupada, we say these mantras. And, so this is something that Prabhupada had he allowed this pranam mantra to be, he authorized it to be used. So it's very close to Prabhupada's heart to eradicate this impersonalism and this voidism. And the way that we can do it is by serving each other. So by developing real relationships, not just a textbook relationship, but real relationships which involve give and take. So, I just wanted to highlight that, as devotees, the whole Vaishnava culture is personalism, the complete opposite of impersonalism. So we are meant to actually serve each other, become personal with each other, and have real relationships. So when we don't meet our needs, now this is like people who are trained up, they will know, they will recognize this. So this is Maslow's hierarchy of needs, and the general theme over here is that we all have needs. We need to meet these needs. So there's physiological needs, which is food, shelter, clothing, and then once those needs are met, we have the need for safety. And so safety is like feeling safe and not feeling threatened by the environment or the people around. And when those needs are met, then there's love and belonging. Then one begins to feel belonged in a certain area. And then when that is met, you get a self-confidence and a self-esteem developing. And when that is met, there is self-actualization, which is what we know as self-realization. So this hierarchy of needs is well known in psychology circles and mental health circles. And the thing with this is that although to some extent everything can happen, like even if you're feeling a bit threatened, your Krishna consciousness can still develop. However, the full extent doesn't really happen until the other needs are met to an extent. So what I'm trying to highlight here is that we do need to be balanced about this. We do need to, like, the examples in the scriptures where Prabhupada is saying, if somebody is hungry and thirsty, you can't really give them Krishna consciousness. So that is where prasadam is such a huge part. And so meeting these needs, we need to see, am I meeting these needs for myself? And when we are talking to another person, okay, where are they up to? What needs are they expressing that they want to be met? And it's quite simple, really. So yes, that's how we go to, that's how we can achieve. And out of the entire population, 1 in 4 people at any point in time suffers a mental health issue, whether it be a psychosis or a neurosis. So 1 in 4 goes up to about 25%, and if you think about it, it's only a quarter, and you might think, oh, this is quite small. But the problem there is that the impact of mental health is felt hugely. It's not like physical health. Like physical health, okay, you have a heart attack, you're managed, and your family, looks after you, or it's just you. But whereas if it's a mental health issue, it really sort of infiltrates families and communities. The impact of it is much wider. It's like a ripple. So also not just that. People suffer 1,000 times more with mental issues rather than physical issues. It's much more painful. And shastrically, the reason for that is the physical body is gross, earth, air, water, right? But then the subtle body is mind, intelligence, ego. So the mind is wrapped pretty close to the soul, the subtle body. And so when we suffer with the mind, the suffering is much more intense. So therefore, a huge need for us to do something about it. So we are not the body, we are also not the mind, but we have to make the mind our friend. And this is one of the basic lessons from the Bhagavad Gita. We can't separate the brain from the body, so it's important to have a holistic concept it's important to look at a person as a whole rather than try to separate the body and the mind. In the sense that when somebody comes in, say, say various scenarios, like if somebody's coming to live at New Govardhan, or somebody's going to come and get admitted at the hospice at New Govardhan, or somebody's coming to get admitted at the hospital. So with various scenarios. But if that person has a physical illness, then you can deal with it, you can treat it to whatever extent. If there's a mental illness, often people will try to kind of just fob it off, or hide it, or separate it, or not acknowledge it. So you can't really separate it. It's all part of the person. We need to deal with the person as a whole. And going back to the triangle, Maslow's hierarchy, we need to try to meet their needs and help them along. So people sometimes think that if somebody's got a mental illness, that I'll catch it too if I talk to them or stand too close to them. So it's not like that. However, avoidance or fear is a sign of ignorance, really. And so that's why we sort of thought that awareness and education is huge. So we really need to all educate ourselves, and with education comes empowerment. So when we know how to do something, we feel more confident about doing something, and then we can actually be helpful. Not just in a crisis situation, but also in, like a day-to-day sort of situation. So our little humble attempt is to try to, raise awareness in fun ways. There'll be fun activities that we'll be doing as well, and to just sort of, to whatever extent, to try to empower everyone, not just the team. So one thing I want to say here is about boundaries and self-harm. First do no harm. So, a lot of people said to me, I don't want to come today. I just want to serve Krishna. Don't really feel is the right thing and like that. So now that's fair. That's been true to one's own self. However, and the reason for that is that some people just don't have the strength or the tolerance to deal with that, to deal with or the patience, So it's important to know that, and also as an act of self-preservation, to actually know what can I do, but not harm myself in doing this. So it's important to know and this is why we sort of created an offshoot of the whole Vaishnava care group and went into a mental, like a niche sort of little group. So, let's do the next one. So what we've done now, after a lot of the poster idea has been floating around since December 2020 or even earlier than that, but I started, Ambika Prabhu actually sort of gave me the responsibility after a lot of discussion with everybody to kind of do the mental health thing. So and as you know, I work as a doctor, so in the community, and I've been working here for 10 years in town. So naturally, I was already doing it to some extent, like people would call me and say, this is happening, what should we do? And I give them advice, and they would do that. So there were a lot of mental health crises in those 10 years, and some of them came to me, some didn't. But so it was already happening in that way. So I couldn't, and it took a long time to get to this stage, basically. And then, so what I first did in March 2021, created a Facebook group, and I don't have the link over here, but it's Devotee Care for Mental Health and Wellbeing. And there's right now there's about 600, 700 people on it. And the aim of that group, myself and Danisha administer the group. The aim of that group is basically to sort of post inspiring things, supportive things, helpful things, but also anybody can send a message to the group, and myself and Danisha are the people who read those messages. So so if there is help needed, you can approach us in one of those ways. But this is so there is myself, there is Normalize Prabhu, who has got a master's in psychiatric nursing, right? Got it right? And who currently works as a clinical nurse consultant for the whole sort of area, the Tweed Shire area. And he's done DBT and is working as a clinician in mental health right now. So great resource. There is Nitai, who is also working as a mental health clinician. He's also got a lot of sort of qualifications, DBT, CBT, and all these other things. So, and then there is Danisha, who is a registered nurse, who works at Tweed Hospital and other hospitals. So she sees a lot of cases in emergency, a lot of mental health crises coming straight through. So Danisha as a registered nurse is there to approach. There's Amrita, who is a mental health support worker. She works with patients as their support, as their buddy, and takes them to appointments. And she's actively pursuing some further studies now. She was going to be here today, but she's not able to. And there's Chloe, who is a registered psychologist. And then on the other side, the friends of the professionals who are people who have experience or interest in mental health. So there's Sita, who is studying psychology at the moment. She's a psychology student. There is Krishna Rupa Pravi, who is the women's minister for Australia, and who a lot of people approach. There is Haripriya Pravi, who has done a lot of counseling, who's a teacher at this Gurukul, and also she's done a lot of counseling support work for Karuna Care, which is another establishment. There is Mandakini, who has lived till 82, 83, and who's got a lot of life experience, and who's also done some counseling courses. There is Amarish, who has got a lot of lived experience and common sense, and is able to sort of do the needful and take people, catch them if and when they're approaching. And there is Bharat, who lives on the farm, who's in India at the moment, who is the communications officer for New Govardhan, and he also kind of deals with cases, quite often when needed. So now, sincere apologies to anyone who feels that they should have been on the poster and they're not. The poster is only so big, and we could only fit in so many people. And the people who are on here are not the end all and be all. So it's not just going to be contact these people, you can't contact anybody else, not at all. That's the reason we are having this session today, to try to empower all of us to become beacons, to become sentinels, to become more aware, and to then be able to act in the right way. So that's why we're doing this. So over here, you can talk, anyone, and please pass this message along, so anyone can approach any one of us on either side. You will end up at the same place. What I mean by that is, say you talk to Mandakini. Mandakini, this is what's going on, what should I do? Mandakini will be like, okay, do you just want to talk to me, or do you think you need to talk to a professional psychologist? And then it's like, no, as long as I talk to you, it's okay. Like once a week or something, you could just, call me and talk to me and just, be there for me, that's okay. So that's all a person might need. But if Mandakini feels, or anyone feels that, no, this person seems to need more, then she will talk to one of us, or she can take the person to their GP or their psychologist, like that. So they all end up at the same place. In a crisis situation, those red numbers can be called at any time. How we can be approached? We are all very approachable. We are all in the community. We all know each other. So you could call us, you could send us a message on Messenger, or and we are looking to see how it evolves and whether we need one central phone number for us as well. But that's for the future. So and all the people who are friends with the professionals, they've either got the training and experience already, or have committed on an ongoing basis to getting training. So so that's how those people ended up over there. Okay. Yeah, so this is basically what I said. Like, it takes everyone to actually get something happening. So it takes a village to raise a child. And like I said, when there's a mental health issue, it affects everybody, in a really big way. All of us here today, and then passing along the message, the ripple effect and the grapevine effect, passing along the message if you see something that doesn't seem quite right, contact any one of us, and we'll try to sort it out. That we need to do it like make it your business, because it's then a healthier, happier community all around. To try to help somebody, avoiding impersonalism, but also not overstepping and getting into somebody's personal space. And the main thing here is, when say somebody is being a danger to themselves and a danger to others, like they've got weapons, for example, or they're physically very aggressive. So this is the time you can call the ambulance or the police. And the ambulance or the police are going to come and do what we call scheduling. And then, against their will, they will take the person to a hospital to get assessed. Now, this is only if somebody is a danger to themselves or a danger to others, and you can clearly see something is wrong with them, and they need help, but they're not going to voluntarily go in and get that help. Okay, confidentiality. So, all of us on the poster, we have agreed to keep things confidential. And that means that if you say something, you can be sure it's not going to go around. within the person. However, if there is a chance that there's a danger, that the person is a danger to themselves or others, then confidentiality cannot be maintained. I will be contacted, or one of the other professionals will be contacted, and then we will say what to do. The other thing to mention is, for any one of us there, with the professional side, so we are all covered by our insurance, indemnity, that sort of thing, so if something does go wrong, we will be, the person who has come to me, say for example, would be covered. They'll be basically dealt with professionally, according to all the professional things that we do. But if a person has come to somebody on the friends of the professional side, then they can have a private arrangement that Sita, can you just call me once a week, sort of thing. And only if Sita feels there's trouble, that she's going to contact anybody that she needs to get help for the person. But regarding so let's leave it at that for now. So so we also have a WhatsApp group, and I just want to say that anyone who would like to join the group, who would be able to offer support, driving a mentally unwell person to an appointment is different from driving somebody who's not got a mental issue. It's a lot more demanding. And there's emotional support needed, sometimes physical support needed. So if you feel that you would be able to help in whatever extent, like today we needed help putting up signs around the place, so whatever extent you can help with would be very helpful. Professionals or not professionals, doesn't matter. So please let me know, I can add you to the group. And like I said before, there is the Facebook page, you can send messages there. We will be able to do 3 to 4 fun, educational, awareness things a year, so that as a community we can all mature together. And just an example that I use quite often with my patients is that if somebody had a cut, big cut that was bleeding, we would take them to the hospital for them to get stitches. Like, that's a no-brainer. But at the same time, when somebody is struggling with anxiety or depression or whatever they're struggling with, it's difficult because you can't see it. But then, it needs to be dealt with in the same way. It needs help because it's also a burden that is being carried, although invisible. So it needs to be dealt with. So there's really no sort of shame in it. It's just a problem that needs to be solved. That's all. And it can happen to any one of us. It can happen to any one of us. It depends on a lot of factors. Nita is going to talk about that a little bit later. But if put under prolonged stress, and if you have some family history or a history of substance abuse or whatever, like if there are risk factors, it can happen to any one of us. So we are not so there's really, shouldn't really be any stigma around it. Now this is a prevention thing. I call it keeping your square. It's simple to understand. There's a square. You basically, on a day-to-day basis, you need to do these things to keep yourself mentally happy. You need to have good food, which is prasadam, spiritually nourishing as well, not just good food. You need to have exercise every day, some sort of physical exercise, move your body. You need to have adequate sleep. Some people need 6, some people need 7, some people need 8, right? Adequate sleep. And you need to have interactions with living beings. So human beings or animals, sentient beings, you need to have interactions with them. And as devotees, we try to make these relationships as loving as possible. So doing these 4 things, day-to-day basis, keeps you happy and healthy. Even in ICU, we try to do these things. We try to meet all these 4 things. Okay, so there is some more prevention. So relationships are the main things. is the main protective factor for, and that Untitled was going to talk on later as well. Relationships are what keeps a person grounded and here and sane and happy. Like when you go to an emergency department, most of the time, who's sitting next to the bed is a friend or a family member. You know, people who don't have anybody have, much worse outcomes overall. So cultivating our relationships is where we should be putting a lot of our energy. We are cultivating our relationships with Radha and Krishna by doing our japa, right? But we need to also be cultivating relationships with devotees overall. So having those social supports, having those positive connections, those things are crucial. And they all come through relationships. Then having control and purpose, like having a purpose in life, you know, having a goal, that's very important. There was this article about a while ago, 2 years ago maybe, in the Reader's Digest. It was by the Buddhist monk. He was also saying the same thing basically, that we all need a sense of purpose. And as we get older, we can lose that, but we all need to try to find something that we have a purpose. Short-term goals, medium-term goals, long-term goals. All right, and then when something goes wrong, to actually effectively seek out, effective health seeking. So a lot of people either don't have the money, or they don't have the time, or the transport, or whatever, to come and see a professional. But that's where we are trying to help as a community, to pitch in and do the needs, fulfill their needs. Okay, so there are some strategies that we've come up with, and we have been doing as a community, like yesterday Sadhana had a group of ladies over 40s, single ladies over 40s, socializing at Srimati's place. And then Nika has been talking about doing circles, of men's circles and women's circles. And I've been doing picnics once a month on Sundays, which I've stopped for a while now, for maybe 6 months or so. But these are all opportunities to connect and ground. And obviously festivals when they happen in New Govardhan, a big part of that is socializing. So, some more strategies. Damodar Pandit was telling me that, there's a questionnaire that every devotee could do, which he got given this questionnaire in an Ayurvedic clinic, but it basically really helps to shine the torch on you. Have you chanted today? How many times do you do this? How many times? How many friends? So it kind of makes you aware of where you stand and what areas you need to work on. So are there any other strategies that we could do? And I would just encourage us all to think about this, and also let's get started doing these things. So today is just an inaugural presentation, but it's going to keep happening. So no matter how little you think you are, or you think it's not going to be of any consequence, but do try to help someone. You really might be the only one that reaches out to them on that day, and it makes a difference. So this one here, I'm just going to say, this is what Prabhupada wrote down. It's not his handwriting, but this is what the priorities that we need to be taking with ourselves. And health, as defined by the WHO, is an absence of disease or infirmity, physical, mental, social, and emotional well-being, as well as an absence of disease. So, like all these spheres are covered in that, physical, social, emotional well-being, everything is covered in that. And this is the priority. So, health comes first. When we have health is wealth. When we have health, we can do our japa properly, we can do our service properly, we can do our reading properly. So as it's really hard, isn't it, to balance our spiritual lives and our material lives, and then to, think about what priority do I need to be doing things in. So this is it, basically. This is what Prabhupada wanted us to do. So now, just some things to raise awareness of people that need to be kept a closer eye on, or people that we can be more empathic towards. If somebody lives alone, if somebody has a history of substance abuse in the past or current substance abuse, if there's a known mental health condition, if there's a trauma, like recently there were so many floods, if there's poor living conditions, these are the fringy kind of people that we really need to be extending more support and more help towards. So yes, like we said, it's devastating, the impact of mental health, and suicide is actually the number one cause of death in that age group. Between 15 to 44 years of age, it's the number one cause of death, not cancer, not road traffic accidents. In that age group, it's actually suicide. So some of the danger signs, which are also on the poster, is withdrawing socially, just not wanting to talk to other people, isolating oneself, feeling really angry, and feeling a burden, really having this feeling that the world is going to be a better place without me, and I don't want to, talk to other people about my problems. Sleep being affected, either too much sleep or too little sleep, low mood, not caring about your self-hygiene, or verbalizing an intent, verbalizing an idea to take one's life, giving away possessions, like precious possessions, is giving it away, not caring for that anymore. So I just want to highlight two things here with the danger signs is, so there is a certain point up until you can help people, and then after that it becomes extremely difficult. So I'll give you an example, so once I saw a patient in emergency, and she was a grandma, she was probably 60 years old. She came in with her son and her daughter, and they brought in pictures of dog, like their family dog, and the children and happy times, like a party, balloons. They got in all these happy pictures, a picture board with her. And they kept trying, like she was really agitated, unfortunately, very emotional, wasn't able to be calmed down despite having her loved ones around her and despite having a positive focus, like those happy pictures and those grandchildren and those relationships. She was not actually engaging or linking in with any of that. It wasn't enough at that stage. So that's when professional help really comes in handy and is absolutely needed. So they did the right thing by bringing her. But what I'm saying is, even on the Beyond Blue website, it said that ideation and intent and ideas, but what a person actually feels and goes through close to wanting to take one's life is not that well understood. It's actually not that well understood. But these are some of the better known signs. So this withdrawal and this isolation, they're real things. And not wanting to feel a burden. I'll bring Chaitanya's example. Chaitanya was my god brother, and we all loved him to bits, and I kept offering him, come home anytime you want, here's my phone number, call me anytime you want, but he would always say, I'm okay. To me as well as to his family, he never wanted to feel a burden on others. And he was okay for a long time until things went wrong at the end, and we know what happened. There was, the floods and all of those things. So we can see objectively we can see that these factors really do happen. Okay, I'll hand over to Nikai now, and after Nikai we will have Dhanutari Guru and Amarish and Priya as well. So and we'll have a discussion at the end too. So open discussion.
Thank you for sharing. Thank you everyone for coming here. It's such an honour to be here and share some of my knowledge with the community over here. Going back to what Kishore was talking about, the importance of health as a priority, that we have. So this is just a transcript by Devotee Krusha. You can read it here. There's a YouTube clip. We don't have time to share that today, so for the sake of time, we're not going to show it. But basically, what she's talking about is Prabhupada had handwritten this and put it up in the kitchen because Jadurani had come to visit and she hadn't been taking care of her health. And so Prabhupada prioritized health being the number one thing, because if you don't have good health, we all know that we can't do anything else. We can't chant, we struggle, even if we can. So it's about being able to prioritize the point of that topic. And mental health is a part of health, as Kishori has been talking about. We'll look at the definition of mental health. So we know the famous verse in Bhagavad Gita, controlled mind is our best friend and controlled mind is our worst enemy. WHO talks about mental health, a state of well-being in which every individual realizes his or her own potential to cope with the normal stresses of life, to work productively and fruitfully, and is able to make a contribution to his or her community. Can everyone see that? Yeah? So, does this sound like something we would want in our community? We would want people to be able to cope with the normal stresses of life? Would we want our devotees to be able to work productively and fruitfully and able to make a contribution to our community? Would we all love that? Would we want our community to be like that? I think so. It would make our community a wonderful community to be part of, right? And I think there's always scope for improvement. So, we'll talk about some of the common mental health illnesses today. I'll talk a little bit about what is mental health illness and, sort of just mental health conditions in general, because they're on a spectrum. So we'll go through depression as one of the most common mental health illness today. This is a common mnemonic that people use, mental health professionals use, to talk about depression. So SIDCAPS, you'll notice people who are experiencing depression, one of the changes you'll notice is in their sleep. So they'll either sleep too much or they'll sleep too little. The second one, you'll see what's called anhedonia, so interest, loss of interest, or lose interest in things they liked doing previously. So if they like chanting, they like going out, they like going for a walk, they'll lose interest in those things. They just won't feel like they can do those things. Third thing is guilt or low self-esteem. So they'll have this huge sense of low self-esteem and guilt, self-deprecating, beating themselves up. Kishori talked about it a little bit. I'm a horrible person, I'm a burden on others, I can't do anything right, I'm good for nothing, no one likes me. Now these are not always true, these are perceptions. Our mind is so powerful that if we think those things, we feel that's right. It's really hard for us to recognize what we feel and what actually is the reality. And that's one of the things with mental health, that we feel so, it's so connected to us, our mind is with us all the time, we can't escape from our mind. The next one is energy level, so loss of energy and fatigue. So people oftentimes will say they don't have any energy to do anything, they'll be sleeping, they can't get out of the house, and we'll see a little bit about how that results in this cascading effect, how it actually keeps people stuck in depression. Concentration, people really struggle with concentration, so you'll probably notice they'll be sitting in Bhagavatam class now, you'll be talking to them and they'll be kind of out of it, basically. They won't be in there, they won't be able to focus. You'll be like, where is this person? They'll ask you, I can't remember anything you just said to me for the past 20 minutes. They'll kind of be a bit out of it. The next one's appetite changes. They'll either eat a lot because that's a way that they feel comfort, or they will completely lose interest in eating. They'll lose a lot of weight. The next one is psychomotor changes, so you'll notice them either quite like, this sort of, they'll be just very, the affect, the body will be very just hunched over, they'll kind of be not very interested, or they'll be kind of fidgeting, they'll kind of, that's kind of like they're kind of not present, essentially, they're really in a different state. The last one, of course, is suicidal ideation, so they will have either an active thought of suicide, which means they've got a plan, they've done preparation, they've got rope, they've got something, or they've got thoughts that kill themselves, but they haven't made a plan. And we'll talk more about suicide in a bit. On the right-hand side, you can see people suffering from depression. Oftentimes we think people who've got depression are people who are sad, as you can see on the right image, but the reality is, half of it is nothing. They might not be feeling anything, not even sad. If you ask them, are you sad? They might say, no, I'm not, I don't feel anything. Just a feeling of emptiness. There might be self-loathing, anxiety, hopelessness, guilt, isolation. So depression is more than just feeling sad. Some of the common things around depression, how to help people with depression: listen to them, just being present, be positive in your approach, be realistic in encouragement. So if someone was bleeding from their leg, we wouldn't ask them to run a marathon. We wouldn't just say, hey, Prabhu, just walk, you'll be fine. We wouldn't do that, would we? But when people have depression, just to say to them, hey, just shake it off, or just chant more, you'll feel better, it doesn't help. It's not realistic, and often it's quite invalidating for people. So people need to know that, give them little tasks, maybe, hey, would you like to go for a walk with me? Would you like to, do something together? But let's be realistic of what people can do. Regularly be there for them, so really let's offer support to people if you can. Helping people get socialized, so it's good for people to be out, seeing other people, and to know that basically some of these thoughts that I have in my mind are not correct, that people do like me, I'm not available in society. Protecting him from alcohol or drug use, as we know, alcohol and drugs, people use them to numb themselves from pain that people are experiencing, and often people have depression for a long time, they can use alcohol and drugs to numb themselves. And it doesn't really help. And the last one is professional support. This is an example from CBT, cognitive behavior therapy, which is one of the most common therapies we often use if you go to see a therapist. So I'll give you a little example of that. You might find it interesting. So the cognitive behavior therapy composed of thoughts, feelings, and behaviors. So how our thoughts affect how we feel, which results in the actions that we do, what we do, right? So if we think, I'm messed up again, there's no point, no one likes me, what do you think we'll feel? Probably sad, probably hurt, probably, really depressed, right? And then what do we do as a behavior if we feel sad, and do we want to go out and be engaging? No, we don't. We want to isolate ourselves. We want to be in our room and just, be in a little cotton ball, just wrap ourselves. So we don't want to go out when we feel sad and, angry and hurt. What happens if we don't go out and withdraw, we isolate ourselves? The thoughts that we had that resulted in that in the first place, those thoughts become more strong. No one actually likes me because, I've been here for the past week, no one's called me, of course no one likes me, and I think that's true. And so that cycle just continues on and on and on, and that's what happens with depression. It's so hard to break that cycle. And what therapy can do, or even a friend, they can help them break that cycle. And it's small steps that we can take to break that cycle. The next one we'll talk about anxiety. Again, a very, very common mental health disorder is anxiety. There's different kinds of anxiety. I'll run through them real quick. Specific phobia, panic anxiety, when you have panic attacks, and that's an extreme form of that. Obsessive compulsive disorder, when people have intrusive thoughts that they can't control, and then they have to do something because they think, hey, if I wash my hands 20 times, then maybe something bad won't happen. But if I don't wash my hands 30 times, then I think, or if I don't fold my clothes a very specific way, something bad will happen to my child, for example. And it's very real. It feels very real to people. Social anxiety, when people feel like others don't like me and they don't want to go out, they isolate themselves. The next one is generalized anxiety. There's a form of anxiety that you feel everywhere. Like it's not limited to one area, you just have that sense of anxiety, worry, fear in every aspect of your life. And the last one's PTSD. So that's when it's post-traumatic stress disorder, when we've experienced, it started with people who are war veterans, but if you've had a car accident, for example, it's really common after a car accident, people can feel still that sense of not feeling safe that just stays with them, and that's what that PTSD is. There's some criteria here for anxiety: restlessness, feeling fatigue, muscle tension, you can feel quite tight in your muscles, irritability, sleep disturbance, worry. Those are all common signs of mental anxiety. We'll talk about suicide again, very important topic. As Kishori mentioned, one of the most number one cause of death for young people in Australia and most Western countries is suicide. 9 Australians die every day by suicide. That's more than double the red road toll. 75% of those who suicide are men. And the reason for that actually is that men are more likely to use lethal ways of killing than suicide, right? So men won't usually write suicide note. They're less likely to talk to other people that they're feeling sad, whereas women are more likely to talk to other people, let their friends know that, hey, I'm not feeling too good. And that's why men tend, that's 75%. It's not that men have more suicidal thoughts than women. The research shows that men and women both have equal amount of suicidal thoughts, just that men are less likely to talk to other people, reach out to other people. The suicide rates in Aboriginal and Torres Strait Islander people is twice. People in rural populations are 2 times more likely to die. Not surprising, LGBTIQ community members experience significantly higher rates of suicide. I was in Govardhan Eco Village near Mumbai in India a few years ago, and devotees, they were talking about this 2 girls from the village community. You know, if you've been to Govardhan Eco Village, it's in a village in India, Maharashtra, that killed themselves, and they were saying their hypothesis was that they were lesbians, they were attracted to each other, and they knew that the community wouldn't accept them, so they ended their life. For each life lost to suicide, impacts felt 135 people. That's a lot. So it has a massive effect on the community, including family members, work colleagues, friends, first responders. Males aged 85 and older experience the highest age-specific rate of suicide. And again, the research shows that loneliness is a big cause of that. We know there's a loneliness epidemic in most Western countries, and older males are likely very lonely. One in 4 Australians are lonely and have no one to speak to. Lifeline is a really great service if you've heard of it. There's a free number you can call to reach out to Lifeline. Every year, over 1 million Australians reach out to Lifeline and access the support. So I think that's a really important support. I often tell people to contact Lifeline. 24 hours of service. They're trained to support people through this, no matter what you're going through. And you don't have to give your details anonymous. They're confidential, so no one will know that you've contacted them. We'd like to show you a video. This is a person who attempted suicide and jumped off the Golden Gate Bridge in San Francisco. Now, this bridge is notorious for people jumping off it, and apparently if you jump off this bridge, it's very unlikely that you'll survive just because of the height of the bridge. This person survived, and they talk about the experience of what it was like. So we'd like to share that with you.
That I was the only one that plowed, but that's so far from the truth, so far from fact. 50 million people around the world diagnosed mentally ill. So many more undiagnosed, but that have the diseases that are in their brains. I don't want to have this disease. I don't want to be flawed. Bipolar disorder, that's not me. I was a wrestling champion in WCL League in California. There's no way. My football team went to state. This is garbage. And I was in so much denial. And that denial ruled the day until I crashed hard. And it was September 24th when it all came to a head. I sat at my desk and I penned that note. Mom, Dad, brother, sister, girlfriend, best friend. Love you, but I gotta go. I was gonna go to the Golden Gate and I was gonna disappear. I thought I was my family's burden. I wish I asked them. I just wanted the pain to stop. That's the common denominator of people who lose to suicide. They just want the pain to stop. What they don't realize is that their thoughts don't have to become their actions. Their thoughts don't have to take over. If you can recognize those thoughts as flawed and illogical, because suicide is a rational state of mind. You think you have to die, but you don't really want to. I found myself in my father's room that morning. I startled him awake. He looked at me, said, Kev, what's wrong? Like with parental instinct. I said, nothing, Dad. I just want to tell you that I love you. It's for the very last time. And, he goes, I love you too, Kev. But it's 6 in the morning, and then I gotta be working until 9, go back to bed. I walked around the other side of the bed, I sat on the carpet floor, and I rocked myself back and forth in tears, begging myself to tell the one man who loves me the most in the world the truth, but the voice in my head said, be quiet, Kevin, you have to die. And that's what took me to the Golden Gate that morning. I took a bus there, and on that bus, all I wanted to do was scream and beg for help and live. But the voice became so loud. I sat on that bus in the back row, middle seat. I'm crying my eyes out like a baby, mucus dripping from my nose. People staring at me now. Then I'm yelling aloud at the voices in my head. I desperately wanted someone to say, are you okay? I would have told them everything. Fear. Apathy. There was a guy to my left, said to the fellow next to him, or pointing at me with his thumb, what the hell's wrong with that kid, with a smile on his face? Apathy. That's his or her problem, but it ain't mine. They bust out to the bridge. I sat there crying. Bus driver turned, he stood, he looked at me and he said, kid, come on, get off the bus, I gotta go. I walked across the walkway of the Golden Gate Bridge for 40 minutes, up and down, back and forth, crying like a baby. Bikers, joggers, tourists, runners, they all went by me. Police officers searching for suicidal people went by me twice. I'm leaning over the rail, crying like a baby. They went by me twice. Nobody cares. And the voice in my head said, jump now, and I did. At the millisecond that my hands left that rail, instant regret for my actions. And the absolute recognition that I just made the greatest mistake of my life. Falling head first, right in my body, accidentally, landed in a position that wouldn't kill me. On the way down, I said to myself, what have I just done? I don't want to die. God, please save me. And I hit the water. I went down 70 feet beneath the water's surface, but I opened my eyes. My legs, I couldn't move. I had shattered my T12, L1, and L2 lower vertebrae into shards like glass. I had missed severing my spinal cord by 2 millimeters. I swam to the surface only using my arms. When I came to the surface, bobbing up and down in water, swallowing salt water, kept going down, couldn't stay afloat. A woman driving by in a red car saw me go over and she called her friend in the Coast Guard. The reason the Coast Guard got to my body within less than the time I was set in hypothermia and drowned was because of that woman making that phone call. The Coast Guard arrived. They fished me out of the water, they put me in a flatboard, they put a neck brace around my neck, and they started asking me a bunch of questions. The guy looks at me, he leans in, and he says, kid, do you know how many people we pull out of this water that are already gone? And I said, no, and I don't want to know. And he said, well, I'm going to tell you. This unit has pulled 57 dead bodies out of this water, and 1 live one. I looked up at my dad and I said, Dad, I'm sorry. And he looked down at me and with great conviction he said, no, Kevin, I'm sorry. And waterfalls flew from his eyes. He put his hand on my forehead and he said words I've never forgotten. Kevin, you are going to be okay, I promise. And that got me through the night. Now I had this opportunity to recover. And a lot of people think that I went from this incident, it was like, oh, I'm so much better now, oh great, it's all gone. No, this was just the beginning. In the first few psych ward stays, involuntary, forced in against my will. But those next 4, I found self-awareness. I found the ability to say, I'm going to accept that I have this disease. I'm going to fight it tooth and nail. I'm going to beat it one day at a time. And that's what I've been doing. Exercising every day, eating healthy most days, educating myself about bipolar disorder, being able to utilize all of those things, work them into a regimen, a routine that helps keep me here. The common denominator of recovery from mental illness is routine. There are so many things we can do that are not clinically based for all the people that don't get clinical care. If you can train your body and your mind to wake up at the same time, Go to bed at the same time. Take your pills at the same time if you're on medication, which helps some people and not all. Train your body and mind to eat at the same time, roughly within a 2-hour period every day. Work out even as simple as 23 minutes a day. That leads to 12 hours of better mood. Your 8-second hugs wherever you can. 8-second hugs release endorphins in the brain to make you feel better. I thought that I had one chance, one choice, and one burden to take care of. I had to die. And I was wrong. Learn from me. Know that your thoughts don't have to become your actions. You were not meant for this world to leave it by way of suicide too soon. But one thing you can never do, one thing you should never do is silence your pain. I silenced my pain for years. I buried it deep down inside me like so many people do, and I lost myself. And it came out in a burst of rage against myself that led me to attempt to take my life. I want you to learn from me. Suicide is not the answer, and you deserve to be here for you. But your pain is valid, your pain is real, and your pain matters because you do. No matter what you think about how you aren't valued or you're worthless, it's not the truth. You have to find a way to turn back to logic. Logic says that I do get to live. You matter. You're beautiful. We need you. Please be here tomorrow.
I often share that video to a lot of clients I work with. I work with a lot of people who are suicidal. Because it's more powerful to hear from somebody who's had that experience than me sitting here and talking to them. The next point I'd like to really mention is what is mental health. We talked a little bit about that. If you can see on the left the mental health spectrum, so mental health is on a spectrum, on a continuum, right? Mental health doesn't develop overnight. So no one just one day suddenly they're fine, next day they've got depression, clinical depression like major depressive disorder or generalized anxiety. It doesn't just happen overnight. It's something that builds and forms over time, and that's the continuum that talks about it. So on the left, the healthy person is coping, struggling, and unwell. So I guess our goal and aim for ourselves and for other people is to really catch ourselves and others when we are moving from healthy to coping. I often tell my clients as well, there's lots of stresses in this world, as we know. There's 3 kinds of miseries, as it says in our Shastra, from our mind, from other living entities, from nature, natural causes. And we've experienced that recently here in this community with floods. So we can't escape stresses, we can't escape miseries, we can't escape difficulties. That's going to happen to all of us, no matter what. Just living in this world is going to be difficulties. But the goal is to catch ourselves, to identify, to take those moments to recognize where I am, to take stock of myself, be self-aware. And before we get to that stage of unwell, we are able to put in supports to help. And we'll talk a little bit more about that right now using this concept called the stress vulnerability bucket that we often use in mental health. We teach our clients. So let's use this example, if that's okay, and I'd like to do a little, ask you guys some questions as well. So bucket, let's imagine a bucket. There's a bucket, right? We all have used a bucket, I imagine. There's a lot of stresses as we talked about. So our work, our family, our children, our relationships, our, just natural disasters, financial pressures, so many stresses of our health, getting older, lots of stresses in life. Uncertainty, deadlines. Now, think of a bucket. You have a bucket that's got a limited size. Now, stresses are the things that you keep adding into it every day. So you will, as you start adding stresses into your life, your bucket starts filling up, right? What we want people to do for ourselves is to add taps into our bucket, right? Holes, so that holes can release the stress so it doesn't fill up. Now, holes are taps are some things that protect us, they're protective factors. We've done that, Jerry we'll talk a little bit more about that in a bit. These are things like, those are things that we all can do. Do you guys do any self-care, any things that you do? Have you gone for a walk? And someone wants to start saying things that they do for self-care. What are some taps that you add?
Yeah, morning walk.
Morning walk.
Japa.
Great. And do you feel like that's a tap that releases the stress? Yeah, japa and morning walk. Anyone else?
Voice gratitude.
Yeah, gratitude.
Verbalize it.
Yeah, awesome.
Meditation. Meditating on nature or the flower or just calming the mind and focusing.
Yeah.
The ocean.
The ocean, yeah.
Yoga.
Yoga.
Talking to a friend.
Talking to a friend, yeah, great. Anything else? So they're great, they're all great, and they're all, there's so many, there's countless strategies that we can use, countless taps we can put. So our goal is try and reduce the stresses that we can add to our bucket. If we can't manage that, if we can't reduce that, then add more taps. The more taps you add, it doesn't have to be something that takes your entire day. It can be little things that people do, right? Next one. The Biocycle social model, I'll talk about this real quick just because of lack of time. So mental health is not just, there's many different reasons why we have mental health. Traditionally in the 70s and 80s, there's the idea of the medical model that you might have heard of. People used to say, it's just all because of your genetics and your chemical imbalances. That model is not used anymore, at least not in Australia. We recognize that mental health is not just a biological phenomenon, it's biopsychosocial, and there's also spiritual that's added to it, right? So we know faith and spirituality and our belief and faith in God can really be a protective factor. It can also be a risk factor sometimes, depending on how we look at it. But we look at biopsychosocial. So biology is things like our age, our genetic makeup, our digestion, our exercise, the foods we're eating, all of that sort of thing. Psychology is, we talked a little bit about this earlier, how our thoughts affect how we feel. So our thoughts, our feelings and perceptions, our worries, how we view ourselves, how we view the world, that has an effect on us, our personality, our nature. Then the third one is social context. So are we around friends or not? Are we lonely? Are we isolated? Do we have friends or not? Do we enjoy our work? Do we get value and meaning at our work? Does our boss appreciate what we do? Or are we a boss, like is a mean, hardy person who puts us down? That's going to have an effect on our mental health. School, education, our community, tribe, all of those things have an effect on our mental health. And it's a cumulative effect like we talked earlier. It doesn't just happen overnight, it happens over time. Next one. So when devotees are struggling with mental health, we may have some misconceptions. I've heard some of these things, and I hope no one takes offense to this. This is not meant to be an offensive thing. It's just to be realistic about what we've all heard. And I've heard this myself. I've heard other people say, Prabhu, you just need to chant a little bit more. They're Maya. We often feel fear of being judged. It's their karma, they must have done something wrong in their past life, things like that. We're able to access help, and that's a big message that I want to send is, when I was saying earlier, faith can be a huge protective thing. The time where it can be a risk factor is this, when we feel like a community is going to judge us because of who we are and what we're experiencing. That's a huge risk factor for mental health, and to not ask help. This is another video. Do we have time to watch this video real quick, or? No, okay. Alright, so this is a video, I'll just give you context of this. So this is a church community in Australia. Do you guys think there's a time to watch a 5-minute video on findings from a research survey they've done in a church community? I think it's a Catholic or a Christian church in Australia around mental health and how people in that community have talked about mental health. Would you guys be interested for 5 minutes to watch this video? It's interesting. Alright, cool. I think.
Probably I might need you.
What I wanted to say was that, it's really interesting, but religions, Islam, Christianity, Hinduism, Hare Krishnas, religious groups, interestingly, there are studies done, and these studies show that people in religious groups, they actually have they're 75% less empathic than people who are not in religious groups. Isn't that interesting? You would expect the opposite to be true, right? That people who are religious, they would be kind and caring and loving and all of that, but it's the opposite. So, and the reason for this is that, if you think about it, in religions, there's also the labeling language, that you're a karmi, you're a malicha, you're a kafir, or whatever, So, so you're a sinner or a saint, so there are these labels, and these labels...
Earlier this year, our institute commissioned...
Unfortunately, they're used as labels and they're used to judge people. So that's why people in religious groups, they kind of deal with labels rather than with the person, and that's what causes this lack of empathy. Now, the other thing there to understand is, when we do our spiritual practices, when we do our prayers, when we do our chanting, or any sadhana that we do, it's actually meant to soften the heart, isn't it? It's meant to soften the heart. So one sign of doing austerities wrong is when the heart is getting hard rather than getting soft, basically. Okay.
And I co-direct the Mental Health and Pastoral Institute with Mary Andrews College. Earlier this year, our institute commissioned McCrindle Research to conduct a survey of Australian Protestant churches around attitudes and perceptions regarding mental health. We'd like to share 4 key findings with you. First, those in our churches who are impacted by mental ill health are really keen for their voice to be heard. 2/3 of survey participants had personal experience of mental health conditions, either being diagnosed with one themselves, 48%, or being a carer of someone, 36%. These figures are much higher than the incidence in the general population, and that suggests that people who are directly impacted by mental ill health are really keen for church leaders and others to know what they think. Second key finding. There's an interplay between mental health and spiritual life. And this is a bit of a paradox. It has both positive impacts but also negative. Let's think about the negative first. The perception is that if you're struggling with your mental health, that this can demotivate you from connecting with your church community and even with God. It's harder to pray. It can make people believe that God is distant and is not there for them. On the other hand, it can also be positive. The perception is that being in need might actually drive you to God and to Christian people to find support, and people turning back to God and finding in Him hope and comfort and strength. And that, of course, leaves us with a big question, which is, how can our churches function in such a way that these positive things, the positive impacts of Christian faith, of community, can support people rather than those negative impacts coming into play? Third key finding, participants in the survey don't want people to be blamed for their mental ill health. When we asked about the causes of mental health conditions, most people talked about external factors, things like environmental causes like long-term stress or the impact of biology and genetics. Very few people said that mental ill health was due to weakness of character or sin, or that the person was being punished by God. I think that's a really pleasing result. Because when we don't put the blame for this problem upon the person, that helps reduce stigma. Now, we did find stigma still there in our churches, particularly around conditions like addictions and some severe mental health conditions like schizophrenia, for example. And those who have experienced mental health condition themselves, they still think there's more stigma in the church than those who have robust mental health. That's interesting too, isn't it? But overall, this shows a deeper understanding of mental health conditions. People recognise that we need effective treatments from mental health professionals, and people are recognising this is not simply a spiritual problem. And that leads to the fourth key finding. More can be done to educate and equip church leaders and members of churches in how to respond well to mental health conditions. Churchgoers believe the church can do a lot more, particularly in terms of pastoral support. 58% of our participants said they thought the church could do better here. And while a percentage of responders feel well equipped themselves, most say that they benefit from further training and education. So I think if we look at the survey as a whole, there is a sense the church is growing in its ability to respond well in this space, and that's great, but it shouldn't rest on its laurels. Let's keep working, doing more, educating, equipping, so that we can offer really good support and care for those who do have a mental health condition. Thank you.
We will address. So now I'd like to invite Dr. Prabhu for his presentation, which is really important about relationships.
Right, so this slide, it's Marshall Rosenberg. He's the founder of Nonviolent Communication. You should look it up if you haven't, it's wonderful. He said, your presence is the most precious gift you can give to another human being, the importance of relationships. And that's the theme, that's the message we're trying to give tonight to people, and Dun and Three people will talk a little bit more about that.
Okay. So the importance of relationships. So we've got general and specific knowledge available to us. From a devotional standpoint, the general knowledge we get is the 6 loving exchanges. That's our real core values of maintaining relationships. So I'm sure everyone knows them, but for the purpose of this, I'll just go through them. So that's giving and receiving gifts, giving and receiving knowledge, revealing one's mind in confidence, and having one's mind revealed in confidence. So here we've got general knowledge, and we can build on that. So one of the things I always refer to with general and specific knowledge is when we're reading a book of tongue, we don't find a recipe for sweet rice that gives us all the amounts, all the ingredients, the method to put it together, any tips that might help us do that. So we want to find specific knowledge for cooking, we'll go to a cookbook. So it's the same when we're dealing with mental health. If we want to have specific knowledge of how to do things really well, we'll go to specific texts that help us to gain that knowledge. So that's a really important thing that I really want to make that definition. Yes, it's all in there. Our philosophy is the most wonderful personal philosophy that as it was brought up in the previous speakers' realisations that they were sharing is we're pretty impersonal. That's recognised by a lot of people that I speak to within our communities is we see people as, so I'll give an example for that just to try and add some context to it. So that person's a cook, that person's a pajari, that person's a gardener, but really they're not that service, they're a person. So that person's made up of their experiences, their thoughts, their feelings and their desires. So is every cook the same? No. Is every gardener the same? No. So that's how subtle it can be, seeing personal and impersonal. So if we want that personal fact, we have to see that's a person who cooks, that's a person who does a service as a gardener. So when we see and refer to people as the services they actually do within our community, that's a quite impersonal way of addressing someone. So if we want to get deeper into the specifics, we have to comment on the person. We have to know those people in context with the service that they provide. I'm quite happy if anyone wants to jump in at any time while I'm talking and add their comments. I like that interaction. So just jump in, don't put your hand up, make a comment as you please. Okay. So, question for everyone. How do we get good at something we do? Practice. Beautiful. Any other comments how you get good at something you do? I don't really need that for a group. Yeah, beautiful. So we get the experience of someone who has more experience than us. Any other suggestions?
Natural proclivity.
Yeah, so we've got a natural talent or a natural ability to perform that task.
Perseverance.
Yep, perseverance. So we keep trying, and we get good at it. So a lot of those are repetition. We keep doing something and we get better and better and better at it the more we do it, and the more we seek other people's knowledge and experience and persevere with it, we get better. And we try and build, as Ambrish said, on our natural talents, which really helps if we want to get good at something. So what's the point of bringing that up? The point is, if we practice being personal, we get good at it. And so there's two sorts of knowledge that we generally access as human beings. One sort of knowledge we access is our default mode. Anyone care to give us what default mode is? Please?
When you do it without having to think about it?
Yep.
It's just your natural ability to do that?
Yep. So an easy way to say that, thanks Ryder, is default mode is our hardwired response. So it's just what we go to without having to make a conscious point.
Flight or fight?
Yep, so the fight or flight syndrome, so that is what we go to when we're in a situation. It's our standard response. Some people will, in a situation of danger, they'll stand up and fight, and some people will run. So that's a really good default mode. That's getting right down to the core of what it is. So your default mode is what Srila Prabhupada really gave us the science for, to go beyond our default mode. Eating, sleeping, mating, defending, birth, death, old age, disease. So he also said if you want to become Krishna conscious, first become conscious. So that's the opposite of default mode. Having knowledge, having conscious choice, exercising those conscious choices, getting good at exercising those conscious choices. So if we want to get personal relationships, you have to exercise those conscious choices all the time. You get good at it. So another example I always give to give some context to that is relationships between men and women. So this is a generalisation, it's not specific for everybody. Women like to be complimented. You look well today. I like your hair. I like your sari. You look beautiful. For men, that's not often our conscious choice to actually communicate that way. So we may recognise those things, but we don't actually voice it. We're not consciously using it. So the more we verbalise those things, the more we get good at it, the better we get at it, the feelings will follow. So you'll actually go, you look beautiful today. I like that dress you're wearing, and you'll feel it, and it'll feel good, and then you'll get that personal interaction. So it becomes a conscious choice all the time, and you're doing it. You get choice, so that knowledge is empowerment, that it actually builds relationships, which is the main message I'm trying to get across in this little talk. So by practicing that, we build relationship quantity, we build relationship quality, and relationships are the best determinant of living to a healthy old age, and I stress the healthy part. You can live till an old age, but it doesn't mean you're particularly going to get there healthily. But if we do practice personal relationships, out of all the variables that have generally been studied, the number one thing that comes up for living a healthy, long life is the quality and quantity of your relationships. So to actually practice these things, we have to understand them as important to us. So if we want to have a very poor, sad life where we die lonely, which is the experience of a lot of people, for us that work in healthcare and deal with all that, we see it quite regularly. It's quite a tumultuous time. Now, working throughout the hospital for many years, we get a lot of comments on how devotees leave their body compared to how a lot of people that don't have the benefit of our science and that knowledge of that science, the passing is quite different. So use this science is what I'm trying to say. I'm just going to share a few things with relationships and just points that are personal realisations to me, because words that are spoken from the heart enter the heart, so I'm trying to get that point across. So fanatic and erratic, trying to follow something all the time. If you're a fanatic, that it has to be a certain way all the time. So if you have to go for your morning walk to maintain your mental health, which is important, but you have to do it at 6 o'clock in the morning, you can't do it because there's a light rain out there, it's too cold, you get that erratic result. But if you just persevere, as we got before with perseverance, sorry I forgot who made that comment, perseverance is really good. So when you're trying to build a healthy routine to maintain your health, perseverance and not being erratic is really important. Just go, just do it. It may not be perfect, but you'll get good at it. If you're trying to build a relationship and that's an unfamiliar comment or communication that you have, just do it, you'll get better at it. Analysis paralysis is another one. So overthinking things, catastrophizing, Nitai put into that before, is where we overthink things and then we become anxious about all the different outcomes. So 99% of all the things we worry about never happen. So it's a good conscious thought where we try and remember that. But what's the actual chance of that happening? And that leads to specific therapies like cognitive behavioural therapy, where we actually challenge those thoughts and those worries that come up, and then we put in place an action that challenges that thoughts, and then we get good at having a better or different outcome. Here's one of my personal favourites. Communication, 60% more effective with touch. I noticed in one of the videos, he's got to have his 8-second hug. You've got to get into the hug. It's not just a little passing bit. Great. I'm encouraging good hugs. Embraces are well documented in Krishna's pastimes as very pleasurable. You get good at them. You get better at them. The more you practice them, the more you melt into that hug, let yourself go. Be present in that. It really does help. So touch. So if I'm actually talking to someone and touch has become like a phobia in our society, where we have to be careful, especially in our profession. We have to be careful to someone. But if there's an elderly lady, which is probably the most common, but I've had lots of interactions with people over the years, I'll go out there and it's not what I'm saying. That touch, is really, really important. It actually brings up a few good emotions for me, which are pretty healthy, because some of those times are not just good for the person who's giving it, but for the person who's receiving it. For the person who's giving it, it's very rewarding as well. So reaching out, having that touch. So there's all different levels of that. Obviously, with someone you have a personal relationship, it's going to be much more intimate. But someone that you don't know, hand on the shoulder, stand close. It really does help. Touch is a great part of our communication. Anyone want to add anything that before they forget it while I'm talking? Yeah.
So, one of the slides I showed, keeping your square, human interactions is one of them, and I made the point that we do this in ICU as well. And so in ICU, somebody's unconscious, but they have an NG feed, so that's the food. The touch part I want to emphasize is the human interaction over there. The touch is very important for them to not become delirious and to remain present. So this is really important, touch.
Yeah. Don't get me started on delirium, that's a really good. We'll go there some other time. Sorry?
Yes, when you're talking about complimenting people, one could, I'm just being the devil's advocate, it could be seen as flattery and not necessarily sincere, or that someone is trying to get their own way through flattery.
And there's one that catches us. Yeah, in our, it's actually, I'll take it back to words spoken from the heart and to the heart. So it actually is how you're doing it. People will feel that. People aren't stupid, and you'll get someone from a low socioeconomic state, low educational background, but it doesn't mean they're stupid. They'll feel when you actually speak in that way. If you're trying, actually they're more hyper-aware generally. People from that demographic in our society are more hyper-aware to when someone's trying to take advantage of them, because they're used to being taken advantage of. But but they'll feel it. So the one thing that I bring up, and I always think of it, is one who flatters me is my enemy and one who chastises me is my friend. But that has to be taken in context. We really have to know what we're saying when we quote that verse. So I would go for the flattery if we can, you know what I mean? Try and find something genuine that we can compliment something on there and build a relationship. That's my personal thought on that. I hope anyone else got what they think of that, flattering someone?
I think the flattery should be appreciation.
Nice.
So when you're actually appreciating someone by the effort they put in to
Yeah.
how they present themselves or something about their qualities and that's really makes such a huge difference.
Yeah.
Because often we don't know what other people think about us or feel about us. And when someone actually expresses to you how they feel about you,
Yep.
and it's nice, it's positive, it does give you a good, bit of inspiration.
Yep, you've brought up an absolute key point there. So everyone needs validation to actually feel like they're worthy. So when we've got people in positions of authority or power in our lives and they actually validate us, which is appreciating us, just another word for that, they actually do that, we're much more likely to be enthusiastic in our service, we're much more likely to be successful in our service. So it really is important. So I'm going to be the devil's advocate for do the flattery. Chastisement is for certain people who are authoritarian. I'm pretty sure Srila Prabhupada said, look, if it's my disciples, I have a obligation to find their faults and then try and change those faults. But chastisement always isn't fire and brimstone, it's person-specific, which Srila Prabhupada was. If you read many interactions with his devotees, he was person-specific in the way he chastised them, and sometimes it could just be a look or a comment, and it didn't have to be negative, that chastisement, it can be positive. So I think we have to take it in that context as well. So another one I wanted to bring up, and I'm 3/4 full, so if I've got to run out of time, let me know. So the oppressed becomes the oppressor. Really important to know what that means. Anyone care to make a comment on what they see that as?
If someone was bullied, then they might become.
Yep. If someone was abused as a child, if someone was abused in their workplace as a workplace practice, generally we all think, geez, I'm never going to do that. But do you know what actually happens? It becomes our default mode, it becomes our natural way of doing things. And so it's really, again, coming back to that conscious choice. So try not to oppress people, try not to do the negative things that have been done to you, and that means you have to maintain, a consciousness of what that actually meant to you when you experienced it, and then try to do better, and then you break that cycle. A lot of the negative things in relationships that we actually experience are cyclic. So if it was done to that person, it'll be done again, and even right through to a genetic level. So negative things such as alcohol and drugs, can become into the next generation and even more forward than that. So, experiences of genocide can take up to 10 generations to get out of the actual DNA. So we're talking on multi-levels, physical, emotional, and mental. These things go through generations. Okay. So seeing someone as someone with experiences that we are not privy to as a person, and not just a surface as impersonal. So again, just coming back to what I said as that person's a gardener, that person's a cook, that person's a pujari. But what we have to remember is that person is made up of their experiences, their actions, and many other things, their relationships with people in the community, not just the service that you see. So if you want to have more successful interactions and a better experience of Krishna consciousness, try and see the other things that make that person, not just the service that they do. This next point, gratitude equals success. So if we concentrate on the things that we actually have been blessed with in life, what's that likely to lead to? Can anyone hazard a guess for that for us?
Contentment?
Yeah?
Contentment?
Yeah? Any other descriptions? What gratitude brings in our life? Come on, we're grateful for something.
Gratitude.
Love.
Yeah?
Joy.
Abundance, gratitude.
Peace.
Sorry.
Abundance. Abundance.
Yeah, abundance. Yep.
Peace. Peacefulness.
Yep.
Joy.
Yep. Gratitude.
Respect.
Respect is good.
Relationship.
Yep, we're respectful for what we've got. It's important. Very important. Anyone?
Relationships.
Yeah. Yeah. So we appreciate people and we're more likely to verbalise that then, which builds that relationship. Excellent. Okay, so gratitude is shown to increase success. So whatever you do, whatever austerity you're performing, whatever you're trying to achieve, people, was found in studies that if people just wrote down what they're actually grateful for, rather than a grand plan of all the different stages they have to go to achieve their goals, it was found that just writing down things that you're grateful for will increase your success. Please.
I read a really lovely book by Brené Brown called Gift of Imperfection, and in it she's a researcher, and she researched thousands of people on shame and guilt, and in her research she correlated gratitude to happiness.
Yes, yeah. So you remind me of another one, thank you. So what is happiness? So when we look at the experience of happiness, we always want to be happy. So there's two things. One is gratitude, and the other thing is humility. So if we're grateful and humble, that will often lead to happiness. Everyone says, "I'll just be happy," but concentrating on what will make us happy is often a better way to get there, to experience that emotion, and I'm talking about lasting spiritual happiness. That gratitude and humility really do add to that. Okay. So I really just want to come back to that point that we have the most wonderful science. We know that anyone who's practiced this science, and I see many people that have been practicing this science of Krishna consciousness for a long time, I just really want to encourage everybody to understand that we can utilise all of these knowledges for our mental health and well-being to enhance our experience of Krishna consciousness. So, if I find a great recipe somewhere else that's not in some Vaishnava cookbook or wasn't handed down, and I use that and I can please the devotees with it, great, you know what I mean? So use what works, be practical, find those things that work, and you'll find, as we talk about, as these groups go forward, hopefully we'll be able to give some presentations on dialectical behavioural therapy, cognitive behavioural therapy, and different ways. You'll find all of them are just following what Srila Prabhupada has already given us, but in a more specific understanding and practice that helps enhance our experience. It's all about relationships, either your relationship internally with yourself and your understanding of how to calm your mind, or your interaction with people. So DBT is made up of three things that give us skills as human beings. That's emotional regulation, distress tolerance, and interpersonal communication. Who doesn't want those as a devotee? They're all key aspects, but it gives us specifics that really help to build on our relationships, which is our core determinant of longevity, happiness, and again, this is a special birth that you've got here. Get the most out of it, because it's important while you've got the opportunity to take it. I think I'm pretty much at the end of everything I've got there. Try and relate everything that I've spoken to today back to those 6 loving exchanges: giving and receiving gifts, having one's mind revealed in confidence, revealing one's mind in confidence, with the key word being confidence. Keep people's confidence. It's important for building relationships. Gossiping about people is really detrimental to the relationship. If someone approaches you with something, especially in relationship to mental health, please try and be confidential. We may be bound as professionals and other people may not, but it's just as important as a professional and to someone who's having a general relationship in the community to maintain that confidence, please. And then, you know, what's our core business? Giving and receiving prasadam, you know, it really does start all those other ones off. So, you know, try and make that personal too, you know, cook something someone really likes, go out of your way to do it. It's generally how I've got through my mental health career with all my colleagues. To build my relationships with my colleagues has been with prasadam. You know, I go out of my way to bring really nice prasadam, and in nursing, you know, you can be the most fantastic nurse with the best patient outcomes and you need your colleagues to support you with that, but one cheesecake, up you go. Thank you, everybody.
Thank you so much, everybody who have come today, and thank you very much, everyone who has presented so far. We've got one last slide to go, last but not the least. So, but before we get to that slide, I just wanted to again appreciate everybody who's left, and let's just take 2 minutes to ask Priya and Amrish to come and talk about this, and then I'll wrap it up. And we'll have discussions.
So, we are at the very tail end of our presentation. I will be very brief. This slide was originally supposed to be spoken about by Amrita, who is a mental health social worker, but she couldn't be here today. So I just wanted to talk about the role of support workers in the community and the importance of them. So support workers are people who work with other people with disabilities, and they might help them to just fulfill their everyday tasks. They might make sure they're taking the medication. They might just do visits with them, just be a listening ear and an empathetic person, a friend. And they are also trained in monitoring any decline and ensuring that they have the supports in place. Now, do we need to be a mental health support worker to provide support to another human being? Absolutely not. So I just need to stress the importance of, you know, a buddy system, being friends and being someone for someone to talk to. And Kishore will speak a little bit about buddy system at the end. But I just wanted to invite Amrish to speak about his personal experience with support workers and how they've helped him quality of life.
Okay. Haribol, everybody. Hare Krishna. How's it going? Everything's going good? Yeah, I have 2 support workers at the moment. One's IU, but he's gone through some problems at the moment. He's going through some problems at the moment. And the other one's down at Pundit, and I find them to be very helpful because before I had them, I was not a lot of the time, quite a lot of the time, I was isolated and I was alone, and because of that, I even noticed my mental health was on a decline. And I wasn't doing too well in that department. And then they came in and they've helped me a lot. Even it's just someone that's there that comes and regularly sees you, and that helps me a lot because it's like I've got a regular person I can go and see and talk to and share experiences with and share prasadam with and everything, and go to my appointments. They help me get to my appointments, which is very, very good because they help me get to like a psychologist appointment or a doctor's appointment or whatever it might be. And it's really good having that there, because if I didn't have it, then my mental health wouldn't be good. and my well-being wouldn't be good where it is now. My mental health wouldn't be where it is now. So it's really good to have this support, and I hope I can continue. I can continue receiving it for as long as possible. And whoever else is struggling with mental health, I hope they can also get support, because people definitely need it in life, because we're human beings are social creatures and all social beings, and we shouldn't be isolated and alone, suffering in our own mental agony alone, because we're social beings, and as social beings we need to socialise with other human beings and get the support of other human beings, because we can't be alone and suffer like with our mental health. So thank you. I've shared enough, and have a good afternoon. Hare Krishna. Thank you.
So thank you so much everyone for being here, and just to kind of wrap things up, so we are intending to have, this was like a big one because it was the first one, and we had quite a few people from our team speaking today. This is not always going to be the case. We're going to have smaller, more manageable sessions, and also little group sessions as well. And one of the sessions that we are really planning to have is an empathic communication one, which is we're dealing with labels. Actually, I don't know if you're aware, but my Gurudev has written a book called Empathic Understanding Your Nature Connected to Krishna. It's an empathic communication book, and all the teachers at the Gurukul have it here. Anyway, he also did a session here sticking labels on each one, and people trying to guess. So we will actually be doing, not copying that, but doing that to some extent. And we are planning to have 4 big sessions a year, but also smaller ones. And the other thing to just say to wrap it up is, again, the poster is only so big. It could only fit so many people. Now, people on the poster and people off the poster, all of you here, we are all equally important. We all need to be sentinels, we all need to be personal, we all need to try to be helpful. So the people such as, Amurti, Damodar Pandit, Ayu, Karunika, Loki, all of these people who are not on the poster, but they are in the WhatsApp group. Radha Ikrat, she's another one. She manned the Good Samaritan hotline for 2 years. So we are very lucky. We have a lot of people with a lot of skills and talents, and I'm sure you appreciated hearing from some of us here today that you can actually hang your hats on some of our professional skills and have a bit of faith that they're going to help us out. So so everybody's equally important. So please don't feel we are all in it together. It takes a team. Together, each achieves more. We really need everyone. It's a big thing. We can't do it on our own. So everybody's equally important in all of this. So Srila Prabhupada was the greatest psychologist. I realized this, and I just wanted to share that. And let's go to the buddy system quickly, which is basically a system that I'm trying to work out with management here. And it was Amrita's suggestion, because she does this at the moment as a support worker, is that, if somebody living at New Govardhan has a mental health condition and they have disclosed it to management and they are happy for management to tell us, one of the team, then we will be informed and we can then provide them with a mentor, a buddy, a friend, sort of thing, to keep an eye. Are they taking their medications? Are they okay? Do they need help? That sort of thing, to check in regularly. Now, this is not just going to happen on New Govardhan, it's also going to happen in the greater community. So if you know anybody who is too shy to seek help or who wants to link up, please don't hesitate to contact us. And also regarding the WhatsApp group, like I said before, it's, cooks, drivers is everything, but more specifically for mental health sufferers. So if you want to be part of it, please let me know. I'll add you to the group. And finally, let's now open the floor for discussion. And I guess actually before that, I'll just say that so because there is a need in the community, I've actually been talking to management for maybe 2.5 years. My first discussion was on the 1st of October 2020. And since then, we've had various meetings, various discussions, and then we've come to this point, of being able to do this. So it's taken a while, but that's what, and you saw that video of the church offering pastoral care, but that's what we're trying to do, basically. So we're here, and then getting to your question that you had about, if there's something that happens, a natural disaster, that, there's a color code system that people are contacted, so to speak. So now, thank you for bringing that up. And it's for people who hold positions, authority roles in the movement. It would be their responsibility to see that the congregation and people that they have taken responsibility for are well cared for. And so I guess to some extent that has become our role as pastoral care coordinators. So if there is, so that's what we'll be trying to do, to reach out to people, to have a system, to make sure nobody is left out in any way. If there is a need for, like you said, you are connected to the farm by service, and most of us are. So if there's a need to feel that coming from Ajita Prabhu or management, we can certainly look at that. And you've already given Suvarna the idea that this is what should be done, and we can also, as a team, try to discuss a good sort of solution, a good system that works to sort of get everybody in there. Would anybody else have anything to say?
Just to pull this together originally and start with all the background work, we should acknowledge input.
Thank you for that. Okay. So, so my understanding of it is that a while ago, probably 5 years ago, Ladini Padma, then known as Padma, now known as Ladini, she had this vision of, she had a vision of many things actually. She had a vision that she wanted, to have like a zoo, not a zoo, but like a situation where people would come and, have cows and like pet the cows and have like a day sort of thing. And she also had this vision of actually doing a mental health thing, really good. So she tried she gave the concept, she gave the idea, and it tried to get off the ground in a few ways, but personally I think it never was the right time, and there were never the right people, at that point in time for it to happen. And there has been a need simmering along. And for myself personally, when Ambika Prabhu said, okay, Kishore, you do it, December 2020 onwards, then I talked to Ladini first, and I said, hey, do you want to do this? And she said, no. I've done she also did you might remember, I think it was 3 years ago now, 2019, in the Gurukul Hall, she pulled together a really big conference and a lot of people from different areas spoke. So that was very nice. So yes, thank you very much, Prabhu. So when I then had the first meeting, this was probably December 2021 with everybody, that's when I kind of gave the background of it and acknowledged Ladini, but publicly, yes, it's she's put in a lot of background work. And then over the years, Ambika Prabhu, Aindavi, Damodar Prabhu, they all tried to, form different things to get it off the ground. And Are You Okay was one of the things we floated around. So it's finally crystallized to this. And I guess in my mind, because I work in emergency departments, the way it's structured is kind of it works, it makes sense, so I'm trying to replicate that. And in that there's going to be, even though there's going to be so many people, they'll all be able to, link back to the professionals and say, hey, what do we do? And all the professionals are going to give the same answer. So you'll end up at the same place. Whether you contact one of us on the poster or you call one of those helplines, it's going to be the same answer. So, yes, anyone would like to say anything or comment or... Yeah, Biocycle.
Just in response to the video that we watched about the suicide survivor, and in connection with something that you said before, that I was wondering if we could, I have a question, but it doesn't have to be answered now, but we could have a workshop on it. So my request is that we have a workshop on when that boy was decided, was explaining what he was going through his mind, and he went to speak to his parents. It reminded me of my brother's best friend who did the same thing, but he didn't survive it. He went to his parents and he said that same thing, I love you, and he wanted to talk to somebody. So when we were talking about inquiring confidentially, which we understand is running exchange. So how do we, but thinking about that way that boy was not, he wasn't able to reveal himself to his parents, even though he knew that his father was his well-wisher, or perhaps he wasn't sure. So he had a doubt. So I would like to know, if we feel that someone needs help, how do you inquire confidentially from them so that their doubt, their own personal mental, like you talked about mental agony, how can you, what sort of mode, I'd like us to have a workshop on the mode of communication that inspires the person to reveal their mind.
So you want some input now?
Well, yeah, if there's, yeah.
So, it's, no thanks. Generalising things, great, but specific things is really difficult with people who are suicidal. Someone may be suicidal for a very long time, like chronically suicidal for 20 years, but actually never act on that plan. There's almost zero way of actually predicting when someone's going to go through it. Everyone's been looking for that, but the best way of actually doing it is to normalise mental health in my perspective and experience. So I'm making that very clear, this is just my perspective and experience, is that if we normalise mental health and make people feel comfortable in revealing their mind and feeling that it's okay and mental health is an everyday part of life, we're more likely to have that opening of that communication to be able to alleviate their fears, convey our feelings that they're worthwhile, that they're loved, that they're appreciated, and what they're going through now will often be a temporary thing and pass.
Yes. Now, when you said 20 years, did you say 20 years?
Yeah.
20 years. Well, straight away, I thought of those persons who are thinking suicidal thoughts for so many years, but actually it's a call for attention. Or it's a call for help. And then it begs the question, if someone is really serious and in great danger, or if someone is looking for attention.
Yeah, so some of that can be there, some of that can be their hardwiring in their body and the way they're actually made up. It can be part of their karmic experience that it's there, but again, it comes back to us actually being supportive as a community, providing safe places, providing opportunities to speak that will actually make the difference. Because I'll bring it back, there's no actual predictors. Someone could be in that. And often people will, in that cry to help that you were explaining there, they'll... is everyone familiar with the term misadventure? I know you and you us. So misadventure is when you're actually making that cry for help and you take an overdose or you get a rope out or you cut yourself and it's just actually a cry for help, but it goes too far and those people actually die from that. So we can say that's, you know, due to misadventure. So that can be a part of it too. So it's just a little extra knowledge in understanding that sometimes people who suicide are actually just trying for help and they don't actually want to complete it. But normalising it, making safe places is our key to success.
Thank you so much for that. Thank you very much for that. Now, I will take the mic around. I just wanted to add to that, which is that I'm so excited we brought it up. And yes, it's going to be really exciting because, you know, it shows that, you know, there's going to be lots of educated, empowered people who are going to help other people, and it's going to make a difference in our community and in the world. So, what I wanted to say is that, just very briefly, the content of that workshop is going to cover suicidal ideation, suicidal intent, and the protective factors and those things. But the take-home message for today is, as Prabhu said, that, say somebody comes into my office, and I get this about 2-3 times a day because mental health is very prevalent. They go, they've been anxious, they've been depressed, and they are not really talking about taking their lives, but it's my job to explore that and to make sure they're safe. So the questions that you ask don't have to be covered up. This is like normalize it. Just be very direct. Are you thinking about harming yourself? Are you thinking about taking your life? Are you thinking about harming anyone else? And that actually gives them permission to open up and feel understood and feel that, oh, I can actually talk about it, it's not such a stigma, you know? So it's normalizing it, and also the safe spaces. So that's why we've highlighted so many of us, that there's many of us, and also the numbers. So it's, and that's why the whole community is needed. Many links are needed. One person can't do it. So yes, I'm excited about that as one of our workshops as well. Thank you.
I think Nico had
I was basically going to say something very similar. So what Dan and Sherry said, when we suspect somebody might be feeling sad, so it's really hard to predict someone's suicide, but we can tell based on their past experiences. We might have heard something. If they are friends, we might know what we call baseline in mental health. So we need to know what that baseline is. Baseline is what's the day-to-day functioning. Because some people, their baseline might be, they might just be feeling suicidal, they might have a suicidal thought for 20 years, but they might never, ever act on that, right? And that's it. And so we don't have to necessarily be worried that they might act on that, but that's just their baseline. So there's a difference in suicidal thought and suicidal intent. The most important thing is that we, like what Kishori said, if they feel that this person, I'm safe around this person's not going to judge me, I can reveal myself to this person, they're more likely to tell you the truth. So if we go to a friend, it's instead of beating around the bush saying, are you not feeling yourself? Like, just straight away ask them a question. Hey, I'm just worried about you. I noticed you're feeling a bit off. Like, are you actually thinking of ending your life? Have you got any thoughts? And they might not have made a plan, but they might say, yes, I've been thinking about it. And that could be your hook. And sometimes it could be that you need to catch up with somebody 2, 3, 4 times before they'll tell you that I have that thought. They might not tell you straight away as well. So that's also a really important thing, that they need to feel safe.
Yeah. When you're asking that question, it's really important to understand as a person who's trying to support them that you don't have to have a solution. Oftentimes people aren't actually after a solution, they're after an opportunity to interact. So you don't have to have all the answers for someone when you're talking to them. So that relaxes you as a person who's responding, but you're just there to their support. You don't have to provide a solution.
Thank you so much. Now, the other thing is, it's a myth that by talking about it, you're going to make that person do it, that you're going to put the idea in their head and they're going to do it just because you brought it up. It's a misconception. So people feel relieved to actually say, are you feeling suicidal? Are you wanting to do it? They feel relieved. You're not going to make them do it, so don't feel scared of asking that question. Instead, they will feel, oh, she gets it. She understands me. I can actually talk to her about this. So that's really important. And I thought of something else there, but anyway, we can go on and on about this because this is so important. It's your turn to talk, not mine.
I can just speak out of that. we're talking about setting limits in the community, and you're talking about, being support to people, when you're feeling they may be revealing something to you and you start a worry thing. And about a year ago, was it a year ago, we set up, some of us set up a Bhakti circle. It was like a hand-picked group to make sure everyone, we had various ages, everyone would get on with each other. And my idea of, it's called the Bhakti circle, so my idea of that is that each one in that Bhakti circle, number one, would then set up their own Bhakti circle. So that the idea was that then pretty much every woman in our community would belong to some kind of Bhakti circle. So we've had a bit of a sabbatical for, from the COVID and the flood, but we'll start up again. So Sadhana set up her own, like from that Bhakti circle, she set up another one which is for women of a certain age and marital status, single ladies. So that's also another really nice way that we can make sure at least almost everyone in our community will belong to some group. And Radha Govardhanadari can talk about it, but we found it really, really helpful, didn't we?
Yeah, it was extremely supportive, and it was good because everybody had a voice, so everybody had a time which they can bring something up or respond or talk. And it was very patient and it was very calm. It was actually quite understanding and loving, and I really appreciate those Bhakti circle meetings. And sometimes you get caught up in what you have to do as a parent and work, and that you don't recognize that actually these sort of groups, they're actually exactly what you need for that week.
And of course it involved lots of nice showing.
Of course.
Core business.
So, yes, and Adi Keshava, he's been attending and coordinating a men's group as well, right? Of some local men devotees. So that's really wonderful. Now, so what I want to highlight here is that it's great that we have, and Krishna also had this, he had an inner circle of friends and a medium circle of friends and then an outer circle of friends. It's natural with relationships to have varying levels of intimacy, of course. And yes, we can only do the 6 loving exchanges with comfortable, confidential relationships. So the point is we do need to all try to improve our relationships. So even if somebody is not in your circle, they actually feel it in their heart to come and help you when you're having a bad day. The other point is that, the circles can become cliquey. So, and people have expressed this to me. How come I wasn't invited to Mukunda Maharaj's 80th birthday? How come I wasn't invited to this, etc., etc., So that's not something we want. We want everybody to feel belonged and loved and appreciated and validated. And that's one reason this team has come together, is to try to have different strategies, different support systems, and different sanghas that we can all show we have our circles, but also we have the group now. And if you're feeling left out and you want to talk to somebody, or if you know anybody who is in that position, please don't hesitate to contact one of us. Now, so if you say contact me and you say I want to talk to a minor devotee, so even if they're not on the poster, I'll try to link you up to the right person. Or somebody contacts Nitai and says, I really want you to do some counseling with me. Now Nitai is a professional, he has his own structure set up, he's going to bring the patient over that way, the client over that way, and try to do that. Or if the client says, no, I don't want to go under the professional banner, just talk to me and I'm happy to give you some luxury for it, that's between them. So, but the confidentiality is always going to be there. And with the friends of the professional side, I just want to emphasize that it's a lot of responsibility. If you are not confident, if you are not trained, it's a lot of fear as well. So this is why if you want to, we'll be running training modules so that everybody's a little bit more comfortable and confident, especially the people on the poster. And this is what they've committed to when they've said, yes, put me on the poster. So, but anyone can be part of it. And thank you again, everyone, for being here today, because it's 2 hours of a beautiful sunny day. Really appreciate you all being here.